Hello, and welcome to ICD 10 Coding Basics, Understanding ICD 10 Codebook. Now, let's go into details. ICD 10 CM layout. Convention and guidelines. The convention gives us instructions on how to properly assign the codes. Locating the ICD 10 codes, step-by-step instructions to locate your ICD 10 codes, and also practical applications to practice locating the ICD 10 codes. The layout. Coding conventions, the official ICD 10 CM guidelines for coding and reporting, the index to disease and injury, and the alpha index with the table of neoplasm, table of drugs and chemical, and the index for the external causes, injuries, and tabular. For example, whenever you're looking up history, personal or family, you want to always revert to history. As we see here, there's an example showing a snippet of the ICD-10 book showing history. And we're looking in the family history of, and it says see also history personal. So you can always look up your own personal history and family history. Sometimes it's really important to know the difference between the two because it's a determinant factor of certain visits. So we see here in the example that it has the family history and it says alcohol abuse, arthritis, asthma, blindness, cardiac death sudden, carry of genetic diseases, so forth and so on. So anytime we're having that basically transition, we need to go under history and family if we're talking about family. Secondly, if we're talking about personal, we're going to go under personal history. That means that anything that you have had in the past, we're going to look under history and personal when it comes to yourself. So for history and family, it's whatever illnesses or conditions that your family has. But when it comes to history and personal, this is talking about yourself. So in the case if you have a history of abuse, or you have childhood abuse, or if there's alcohol dependence, allergies, so forth and so on. So we're going to go into history and personal when it's dealing with yourself. Again, when it's history and family, dealing with your family members, we're going to go under history, and then we're going to go to the subtitle of whatever the conditions or diseases could be. Looking at the alpha index, what is the ICD-10 code for personal history of alcohol dependence? So when we looked at that category, let's just go back for a second. So this says personal history of alcohol dependence. All right, so when we go to history and personal, and we have here alcohol dependence, it shows that in the index, it takes us to F10.21. So going back to that question, it's going to be D for F10.21, personal history of alcohol dependence. Next, this is a table of neoplasm. So we have several categories when it comes to the neoplasm. We have the malignant primary, malignant secondary, cancer 2, benign unbehavior, and unspecified behavior. Majority of the time we're not going to use unspecified behavior, uncertain behavior. That's mostly is not used a lot of times. Unspecified behavior is when we have not confirmed the actual condition or diagnosis is when we use unspecified. But we have several categories here, starting with the abdominal or abdomen. Then we go into the cavity, organs, walls, connective tissue, skin, so forth and so on. But this is your neoplasm. It's very important to make sure that you are tabbing your books to make sure that you are going to those correct areas in a reasonable amount of time. So you just want to be flipping in the pages. So it's important to have this actual table of neoplasm tabbed out. So anytime it's relating to anything that's possible malignant or could be benign, you want to go to this particular area. Now, we have here a question. Code what primary malignancy in the abdominal cavity? So let's revert back to that actual chart. We see here abdominal cavity, and it's a primary because that's the only one that is listed, and it shows that the code is C76.2. C76.2, meaning abdominal cavity. That is your actual code that we're going to look for. So let's go back to the question, and it is B. The next tabular we have is the drugs and chemicals. So anytime that is relating to poison accident, poison and intentional harm, poison and assaults, undetermined, adverse, that is anytime you take any type of medicines or any type of chemicals that causes a effect, have an effect to it, that's adverse effect. Underdosing and overdosing. Okay, so it's just like using the neoplasm tab. We're going to revert to these particular chemicals or drugs and check and see if it indicates that in the documentation, if it was unintentional or if it was self-harm, assault, so forth and so on. We're going to check the categories and make sure we check under the correct area when we are selecting the code. Now, here is a question. Which code is listed in the tabular for suicide attempt using this medication or drug? So let's go back in our chart. We see here, I'm sorry, it's actually right here, and it was intentional. So we see here that the actual code is T as in Tom 43.3X2. Oh, I'm sorry. Wait a minute. Oh, suicide attempt. Okay. Let's go back. And that will be 1 second. Oh, up here. Sorry. And here's the actual code, which will be T51.0X2. Which is C as in cat. See the difference? All right, so we have now the external cause and injury index. External cause codes describe how an injury occurred. Read the notes at the beginning of the ICD-10 on chapter 20 for the external causes of mobility, never primary. Keep that in mind. So, for example, we have an external cause of a fall. The fall is accident, or we can see from building, burning building, fall down, escalator, hill, ladder, ramp, stairs. And then we have a due to, bumping against, object, sharp glass, specified, sports equipment, person, due to ice or snow, so forth and so on. So just keep in mind, we're going to look for that actual main term, and then they have the subterm category for the actual code. We also have a tabular list for disease and injuries, and it starts all the way from 1 to 22. And this is the breakdown of each chapter that is actually in your actual ICD-10 book. And it has all of these different areas, and it has the starts and beginning and end, of each category. Overall, we have the coding conventions and guidelines. Always revert to your guidelines if you're not sure of what needs to be coded for that particular diagnosis or description. Reason being is some of the diagnoses have guidelines to revert back to in the case if a second code is needed for any reason. For example, if you have the code for diabetes, diabetes has to have a second code, if specified, type 2 or type 1, and it also needs to indicate if it's insulin dependent, not insulin dependent if they're taking oral medications for the diabetes, and or controlled by diet and exercise. If it's not indicated in the actual description, we're going to go with diabetes unspecified, and we're already going to default to type 2. Keep that in mind. The conventions for the ICD-10, official ICD-10 guidelines for coding and reporting. Abbreviations, NOS, not otherwise specified, lacks information to use a more specific code. Here's an example. Sinusitis, chronic, hyperplasty, nasal. We have here J32.9 for chronic sinusitis unspecified. Parentheses. It encloses a supplementary words or non-essential modifiers. Example we have is pneumonia. So we have acute, double, septic, and unresolved, which shows J18.9. But when you have pneumonia with lung abscess due to specific organisms, flu, 2019, this is the coronavirus code, so forth and so on. So you always want to make sure you're reviewing your main term of your subtitle and also the subtitle of what you're looking for to make sure that you are coding to full accuracy when you're actually looking for these codes. Next, official guidelines for coding and reporting. Referencing the guidelines. Guidelines found at the beginning of your ICD-10 book. Always make sure you want to highlight and or tab your guideline areas. There are 22 areas in your actual front of the book, and each chapter is specified according to disease or diagnoses that will be given to you in documentation. And it shows the conventional and the abbreviation, the format structure, use of the codes, placeholders, if 7 characters are needed, abbreviations, so forth and so on. So you just always want to make sure when it is available to you and needed to revert to those guidelines. How will I know if guidelines are actually needed? It will specify when you go in the tabular in your book when you're looking at the code that was given to you for direction in your index. Never, ever, ever code from your index. Even though it could be the correct code that you locate, you always want to verify in your tabular. That's how a lot of coders actually get things incorrect, because they say, oh, well, it looks like the same code that it will build in the tabular. Always confirm it. Referencing the guidelines, a documented reference appears as section 1.C.4.A.2. So anytime that's shown in your actual tabular under a actual code, go to the guidelines and see if there's any specifics that you're needing to know for additional instructions. This indicates the guideline is found in section 1, conventional general coding guidelines and chapter specific guidelines. It is also in section 1.C, which is the chapter specifics coding guidelines. I.C.4 means chapter 4, endocrine, nutritional, and metabolic diseases, E00 through E89. Then I.C.4.A, diabetes mellitus, and also the type of diabetes not documented. So anytime you see an example or reference to a particular guideline, please go read your guideline instructions. It's very important. This could be one thing that will cause you to code incorrectly on your documentation. Guideline reference. Here is the example of the I.C.4.A.2. This is a section of conventional general coding guidelines and chapter specific guidelines for endocrine, nutritional, and metabolic diseases. It talks about the diabetes mellitus. The diabetes mellitus codes are combination codes that include the type of diabetes mellitus, the body system affected, and the complication affecting that body system. As many codes within a particular category as are necessary to describe all of the complications of the disease may be used. They should be subsequent based on the reason for a particular encounter. A sign of many codes from the category E08 through E13 as needed to identify all of the associated conditions that the patient has. Type of diabetes. The age of the patient is not the sole determining factor, though must type 1 diabetes develop the condition before reaching puberty. For diabetes type 2, diabetes type 1 diabetes mellitus is also referred to as juvenile diabetes. Diabetes mellitus not documented. Diabetes mellitus is not documented in medical records. Always default, like I said, to E11 type 2 mellitus. Also, diabetes mellitus and the use of insulin, oral hyperglycemics, and injectable non-insulin drugs is always coded as secondary to the primary code. So you always need to make sure that these guidelines are read prior to actually using the code to make sure of accuracy. What does the reference 1.C.7.8.2 refers you to in your ICD guidelines? Good job. So here is the actual reference for that. Code structure. Chapter is based on the body system or condition. Example, Chapter 4 is endocrine, nutritional, and metabolic diseases, E00 to E89. The section, a group of 3 character categories. Example, diabetes mellitus, and also it refers to the E08 through the E13. Categories, 3 character code numbers. Example, E11 for type 2 diabetes mellitus is your example. Subcategories can be 4, 5, or 6 characters. 4 characters further defines the site and the manifestation or state of the disease or condition. Example, E11.6 is type 2 diabetes mellitus with diabetic neuropathy. 5th or 6th characters represent the most accurate level of specificity. Example, E11.610, type 2 mellitus with diabetic neuropathy, Okay? 7th character extenders. Example, T16 is foreign body in ear. The appropriate 7th character is to be added to each code for category of T16. A is for initial encounter, D is for a subsequent encounter, and S is for sequela. So we have foreign body in right ear, and it's the initial encounter. Step-by-step instructions. Number 1, find the documented diagnosis. Sorry about that. Determine the main term. That's always important. Look up the main term in the index to the disease and injuries alpha index. Find the code in the tabular list to always verify. As I said before, never code from your index. Always verify the code of the full description as close as possible to accuracy in the tabular list. Review all conventions and notes associated with the code. Really important. Main term. What is the disease? What is the illness? What is the symptom? Example, we have acute bronchitis. The main term will be bronchitis. So when you're looking this up in your actual ICD-10 book, the main term we're going to look up is bronchitis. Under bronchitis, we're going to look for the subtitle of acute, and you will find your code. Ruptured ovarian cyst, abdominal pain, chronic sinusitis, and febrile convulsions. Now, look up the main term in the index for the disease and injury, as we did, bronchitis, and you see your sub, we go down with, it says, make sure you're looking at those words as well. With, without, in, out, Included, not included, those are things that you need to look for as well. If it's indicated in your documentation, make sure that in your description that it also has it for your code. So let's look at the example here, bronchitis. It says with flu, obstruction, airway, lungs, and it also shows acute and chronic. Under 15 years of age, and then we have acute, subacute with bronchial spasms or obstruction, which is the same as the acute, subacute. So we just need to make sure that the descriptions are correct when we're looking at them in the documentation, and that we're looking at them in our book to make sure that we are pulling the correct thing for accuracy. Look up the subterm acute, as we already discussed. I kind of moved a little bit faster than the actual presentation, so please forgive me for that. But we already see that the actual subterm is acute. So that shows that that code is J20.9. Find the code in the tabular. This is the actual meat of the book. So we want to actually get the correct actual code. So if you see at the bottom here listed, the J20.9 was the actual acute bronchitis unspecified. Now, anytime anything is not giving more description, or if it's not giving specific details on either the organ or the dysfunction or the malfunction of the disease, always go with unspecified. Read all notes associated with the code. Read your excluded 1 and excluded 2 notes. Those are very important. This is also where, if you see here, even though we're not looking in this area, but it does show you here. See official guidelines, coronavirus infection. It shows here at the bottom that the actual guideline that we needed to look at is I.C.I.G. Most likely it's going to take us to the J20.9 for the acute bronchitis unspecified, and it will give additional detailed instructions on what to code and if a second code is needed. Locate ICD-10 code for the following diagnosis: diaper rash, closed right forearm fracture, traumatic, initial encounter, nausea with vomiting, post-surgical hypothyroidism, and diabetes mellitus type 2. This is all part of your practice. What is the code for abdominal pain in the right lower quad? So for this particular one, we can eliminate C, because what? This is not a CPT code, so it doesn't require any modifiers to be added. But the actual correct code would be R10.9, just because I know that off the top. What is the ICD-10 code for urinary tract infection? What do you think will be your actual main term? Your main term would be infection. The condition urinary comes to N39.0. And this is your conclusion for ICD-10 coding basics. I hope you enjoyed it. We learned the layout of ICD-10, the official guidelines for coding and reporting, locating your ICD-10 code, and how to locate it according to your main term and subterm, and going through our practical applications. Hope you have a great day. Thanks.